touch on the support services available to New Zealanders who may be struggling while we're in lockdown. But first, I'll pass over to Dr. Ashley Bloomfield to update us on the case numbers.
Thank you, Prime Minister. Kia ora koutou katoa. So today we're reporting 83 new community cases since 9 a.m. yesterday, taking our total number of confirmed cases associated with the current Auckland community outbreak to 511. 82 of the new cases are in Auckland, one is in Wellington. The latter is a close contact of an existing case and was in isolation with no exposure in the community while infectious.
That's the judgiest sign language person ever.
So the total number of community cases in Auckland is now 496, and it is 15 in Wellington. 453 of the cases to date are epidemiologically linked, with the remaining 58 links being established epidemiologically and throughout ongoing genome sequencing. There are currently 7 subclasses identified within the outbreak, the two largest being the ones we've talked about previously, the Birkdale social network, associated with Case A, that has 68 confirmed cases now, and the Mangere Church cluster that has 237 confirmed cases. All of the remaining clusters have fewer than 20 people associated with them. Now at the moment we have 34 people in hospital as a result of this community outbreak. 32 are in a stable condition on a ward, while 2 are in a stable condition in intensive care. 3 of those cases are in North Shore Hospital, 18 in Middlemore Hospital, 13 in Auckland City Hospital, while 1 is in Wellington Regional Hospital. And just to reinforce that there are appropriate isolation and infection prevention control plans in place at all hospitals where COVID positive patients are being managed. Locations of interest were 475 as at 9 o'clock this morning, and additional locations that continue to be identified will be put up on our website. So please do keep checking regularly. We are now removing locations of interest from the website after 18 days, because after that time we're not concerned about ongoing transmission or public health risk. Because we are in alert level 4, but it does emphasise the importance of everybody to adhere to those alert level 4 requirements. A reminder, anyone who's been at a location of interest, self-isolate within your family bubble or your home bubble and call Healthline for advice on testing. As you call Healthline for advice on testing, rather than just going out to get a test, that assists us because your contact details will then be entered into our contact tracing system, and we can trace and track your swab more quickly through the laboratories. Now on contact tracing, an update on the numbers there. As of 10 a.m. this morning, there were 32,771 individual contacts that have been formally identified.